Yes, as you all know, and you probably have heard quite a bit today, antibiotics that is effective is very important for all our healths. And now, by telling you my story, I hope to give you some insight as to how important antibiotics can be to a person. As it was said 8 years ago, I was diagnosed with leukemia. I was 21 and went from an active lifestyle with studying and having Christmas concerts with my choir and being extremely social into suddenly being admitted in the hospital and staying there for 2 months. So already on the first day, I needed antibiotics because the blood cancer, it had left my immune system almost useless. Now, I was lucky that there were functioning or effective antibiotics that could help me. If you don't know, leukemia, it is a blood cancer that makes immature white blood cells and stop them from developing into functioning blood cells. So it's quite serious. Yeah. In the first and the following rounds of chemotherapy, my immune system was again knocked out. Both times it did not take long until I got an infection. And luckily, again, there was functioning antibiotics that could help me. Just a few months into treatment, it had all gone quite well until then, but then it became clear that to be sure that we got rid of the cancer, I had to get more and even heavier treatment. I needed a stem cell transplantation or bone marrow transplantation, if you've heard of that. That is a treatment where you destroy the bone marrow and the body's ability to create new blood cells. You destroy it with chemotherapy and then receive stem cells from another person. And the stem cells then find their way to the bone marrow and start producing blood cells in the host, in this case, in me. I was lucky to get stem cells from my sister. But the thing with stem cell transplantation, as mentioned from Kristen, you have to be isolated for a period. So for about 2 weeks, I was practically without an immune system. And that is a time where you just go and wait for an infection to happen. It can be either your own bacteria or something from the outside. And when I finally sort of got an infection, again, I was lucky. There was effective antibiotics that could help me. Now, at this point, I would like to tell you that all went well and I lived happily ever after. But as you all know, with cancer treatments, it's not always the case. Late effects are quite common. In my case, the treatment had gone and affected my lung capacity. So it's not so common, but for stem cell transplantations, it's a thing that can happen. Did you know that you could live with quite well with just 50% lung capacity? Well, you can. It's a bit hard to train and exercise, but it's possible to function with 50% lung capacity. Well, but within a year, it got even worse. I'll just need some water. And if you see me shaking, it's also just a side effect of the treatment. It's all right. Yes, within a year, my lungs got even worse. So I caught a fungal infection. And the thing with that was that it made room for even more bacterial infections. So in a period of 3 years, I was in and out of hospital with constantly new lung infections. And each time they found a bacteria, and each time, lucky for me, there was effective antibiotics that could help me. But as you probably can imagine, this didn't help my already quite reduced lungs. So about 4 years ago, it became clear that to get out of the worsening lung situation, I needed a lung transplantation. And so I was fortunate enough to receive a new pair of lungs. During the transplantation, I once again caught a bacterial infection. And once more, there was effective antibiotics that could help me. Now, this is quite a heavy story. If you're not used to hearing patient stories, then this is, it can be quite heavy. I'm here now, I'm quite well, so please bear over with me. So to sum it up, in about 5 years, yes, I received about 20 antibiotic regimes. And frankly, each time they were necessary and they saved my life. So thanks to effective antibiotics, I can stand here today and I can tell you my story and continue my life. Today I'm studying at the Norwegian University of Life Science, and I am volunteering in the organization Ung Kreft, or Young Cancer. This has given me an opportunity to use my experience to support others who go through similar situations. I will also tell you that the different treatments I have gone through would be extremely dangerous or could not be performed at all if I could not rely on effective antibiotics. Now, today and for the rest of my life, I have to use immune suppressive medications. And this means that a small infection may quickly turn into a more severe infection. But so far in Norway, we are lucky. For now, we usually have antibiotics if we need it. In the future, the situation will probably be quite different. Today's simple infections can tomorrow be life-threatening. And so a lot of cancer treatments and operations we do today will be too risky to perform. And therefore, I would like to take this opportunity to thank each and every one of you for the work you are doing. I stand here today as a living example of how important it is to have effective antibiotics. Thank you.